Today, we have Director Scott Bookman, our COVID-19 Incident Commander, as well as Dr. Rachel Herlihy, our state epidemiologist, to give some updates here on what's going on in the state. We'll go ahead and start with Dr. Herlihy.
Great, thank you so much. Good afternoon to all of you. Thank you for joining us. So I wanted to start here with this figure comparing Colorado cases to US cases overall. This is a slightly different view of our case data than I normally show, but I wanted to show you what Colorado is experiencing compared to what the US is experiencing overall, and share with you that our experience is actually pretty typical for what's happening in the US right now. So you'll see here in Colorado and in the US at the same time, we saw a really rapid increase in cases associated with the Omicron surge. And we have now started to see a rapid decline in cases here in Colorado, as well as what we're seeing overall in the US. So following very similar trends to what is happening here in Colorado as what's happening in the US. I would caution though that we do continue to see really high case rates right now. So while I think we're all feeling very optimistic about this reversal and trend that we've seen over the last week or so, keep in mind in looking at this figure that those case rates are really high, really much higher than we've seen for previous waves, and that the prevalence of Omicron in our community continues to be really high. Next slide, please. Our percent positivity data is showing a very similar trend. So you again here can see that rapid increase in our percent positivity value, followed by a decline in the last week or so. So certainly things are heading in the right direction, both with our case data and our positivity data. Next slide, please. This next figure shows you our hospitalization data. As I've talked about many times in the past, we do know that hospitalization data does lag behind case data and positivity data as far as showing the trajectory of where we might be headed with our surging cases. And so what we've seen really over the last week or so is more of a plateau in the number of hospitalizations here in Colorado. The number is down a little bit today, so it's 1,641. That's a decrease of 33 since yesterday. We've really been hanging out at this, 1,660 or 670 level for the last few days or so. So good to see this drop. I'd like to see this number continue to go down to feel confident that we're in a true downward trajectory for hospitalizations. But the timing is right based on what we've seen in other locations. We would expect that our hospitalizations would start to come down soon. So certainly good to see that today's numbers are lower. But again, I'd like to see more days of declining hospitalizations before I feel confident that we're really seeing a true decline here in Colorado. Next slide, please. All right, moving on to some of the data that we're seeing right now, comparing risk of hospitalization in individuals that have received booster doses to individuals who are vaccinated but have not received their booster dose, and then compared to those that are unvaccinated. And there's really striking differences here in the risk of hospitalization. So this is data that looks at the last 4 weeks or so. It's a 4-week moving average. This is the same data that's on our website, that we don't yet have this booster data on our website, but hope to have that there very soon. Wanted to give you a preview today of what this data is showing. And again, it's very striking where we see that really dramatic difference in risk between individuals that have received a booster dose and those that are unvaccinated. So looking at these numbers here and these age-adjusted hospitalization rates, what you see is that unvaccinated individuals have 46 times the risk of being hospitalized with COVID-19 than individuals who have received a booster dose. When looking at the risk of individuals who are vaccinated but not yet boosted compared to individuals who have received a booster dose, that's a 7 times increased risk. So again, emphasizing really the critical importance of booster doses for protecting individuals, preventing severe disease, and keeping folks out of the hospital. With that, I'll turn it over to Dr. Bookman.
Thank you, Dr. Herlihy, and thanks everybody for joining today. I think we have a tale of cautious optimism here as we look at our numbers across the board. And at another one of these potential turning points in the pandemic, another moment to reflect on how all Coloradans have really come together here to get through the last wave that we have been through. And so, to our healthcare workers and our first responders on the front lines, a true debt of gratitude for all that they have done to take care of everybody in these tough times. And what we see on this graph is looking at COVID hospitalizations and comparing it on that orange line to how many available staffed hospital beds there are. And today we continue to show a bit of an upward trend in the number of available staffed beds. And so again, cautious optimism here as we begin to see cases and percent positivity coming down, potentially seeing hospitalizations stabilizing and starting to come down. We do see the number of available beds on a 7-day moving average beginning to move up. Next slide. So as I said, Coloradans have really stepped up to meet the challenges of this pandemic. And really just want to give everybody a quick update here on where we are with COVID-19 vaccinations across the state. Encourage people who have not gotten their first dose to go ahead and talk to a healthcare provider, talk to a trusted advisor, and let's see if we can get everybody to go get their first dose. For those who have already started their series, important to make sure that you stay up to date. And so if you're more than 5 months past your second dose of your mRNA vaccine, the Pfizer or the Moderna, you're eligible to get another dose to stay up to date. And if you've had the J&J and it's been more than 2 months, now is the time to go ahead and get an additional dose. And at this point, we are recommending getting one of the mRNA vaccines as the additional dose of that J&J. But really want to call out on this slide here too, that more than 4 million people in Colorado have been immunized with at least one dose. 79% of eligible people in Colorado have gotten at least their first dose, and more than 3.8 million people are fully immunized. This makes Colorado 13th among states for vaccinations per 100,000 of total population, and we're 14th among states in the same comparison for those who are 5 and above. So to all Coloradans who have rolled up their sleeve and joined us in this fight, thank you. For those who are eligible to get that next dose, now is the time to do it. And we really want to continue seeing our vaccination efforts keep all Coloradans safe from this virus. Next slide. So, want to give a quick update on a very exciting new program in Colorado. There has been emerging evidence at the national level and recommendations at this point from the CDC that when possible, people upgrade from a cloth mask to a KN95 or a surgical grade mask to get a higher level of protection. And so to ensure access to these types of masks for all Coloradans, we have created a program where at rec centers, libraries, fire stations, other hubs of our communities, people will have the ability to go pick up free masks. And as of today, we have 272 locations that have opted in. We have shipped hundreds of thousands of these KN95 masks and surgical masks. And you can see on this map that these are locations where people can go. They can pick up 5 masks to get them through the month. We thank all the Coloradans for their patience as we've rolled this program out. And we're just so grateful to all of our community partners who have stepped up to be distribution points for these incredibly important masks. Next slide. All right, Brian, I'll turn it back over to you.
Thank you, Director Bookman, and Dr. Herlihy will go ahead and open things up to the media Q&A portion of this afternoon's press conference. Do remember too that we have those interpretation channels available for American Sign Language and Spanish language interpretation. For this Q&A portion of today's press conference, we'll use the raise hand function located at the bottom of the Zoom console. We'll start with first questions first, please. If we have time, we can come back for second questions and follow-ups. Please state your name and your outlet before asking your question. And then anything we aren't able to get to today, email us please at media_info@state.co.us, and we'll get back to you as soon as we can with some information. In the meantime, let's go ahead and start with Sarah Flower. Go ahead, Sarah.
Hi, thanks for taking the call. Sarah Flower with KDUR here. I would like to talk about this notion of people that are testing positive at home and where that data is supposed to go and what the state's prediction models are of those that are testing at home and not reporting through the state. Thank you.
Sure, I can take that question. So we do know that over time, there has been an increased use of antigen tests, these at-home tests. Some of those antigen tests are available at testing locations, clinical settings, but we also know that they are commercially available in pharmacies and other places, obviously through the state as well. And we do have a way for individuals to report those test results to public health. So that is available on our website. There's instructions for how to do that. If you've received tests through the state, we have very clear information on our website on how to go about reporting your test results. But we do know that that is a challenge, and that oftentimes those results do not get reported to public health, which is why we rely on really multiple sources of information to try and understand how much COVID-19 is being transmitted in our community. So we are looking at not just case data, so those cases that are reported to us, but other laboratory data, hospitalization data, and of course, we're working closely with our modeling team, who since the beginning of the pandemic has really been helping us understand what that gap is between the true number of cases that are occurring in the state and the number of cases that are reported to public health. We do expect that probably there's less reporting happening now while case rates are so high. And so we really do rely on, again, multiple sources to have a good understanding of what's happening.
All right, let's go to Meg Wingerter.
Hello, this is the Denver Post. I noticed on the dashboard, it still has that gray bar of uncertainty going back to late December. But what you were showing there with the cases seemed, it looked a lot more definitive. At this point, how much certainty is there in terms of cases and thank you.
Yes, so I think going back to the point I just made about looking at multiple sources of information. So we are looking at the percent positivity data. We're also looking at the number of positive test results that are being reported, which doesn't always translate one-for-one to case numbers because some individuals have multiple tests performed. So we have multiple ways of looking at data to try and estimate if the decrease we're seeing is a real decrease. And at this point, I do believe that we are seeing a true decline in cases in the state. And I think we've been seeing that decline for about a week now. So again, feeling cautiously optimistic that we have turned the corner with our Omicron surge. Obviously, there's lots of unpredictable factors associated with this pandemic, and we've seen new variants, and that's certainly always a possibility. But again, I think we're feeling cautiously optimistic with the trends that we're seeing.
Okay, let's go to Seth.
Hey all, Seth Klayman from the Gazette. Dr. Early, yeah, as you just said, lots of reason for optimism, but leading into the week, the Colorado chapter of the Emergency Physicians Group was raising a lot of concerns about what they're seeing. The governor said yesterday or earlier this week, he told CPR he wasn't considering anything related to the crisis standards of care. Is the state going to be doing anything to provide relief, particularly to those ER providers who are kind of raising pretty serious alarms about what they're seeing? Is anything going to change on their front? Thanks.
So Seth, I'll take that one. We have had conversations with our emergency room physicians, just like we have had ongoing conversations over the course of this entire pandemic with healthcare leaders across the state. We know that our ERs have been hit hard in the last few weeks. Just the sheer volume of COVID cases out there has resulted in a lot of people presenting to our ERs. I do want to stress to the public that it's important not to go to the emergency department for the sole purpose of being tested for COVID. Of course, if you're sick, you need to seek the appropriate emergency medical care. But there are 150 community testing sites available across the state, and those are really the place where people should be going to get their COVID tests, not the emergency room for the sole purpose of testing. But we continue to work with our healthcare system partners. Our Combined Hospital Transfer Center, in partnership with Colorado Hospital Association, continues to work to decompress hospitals that have areas of higher volume to areas of lower volume. And I think that with these really encouraging numbers here, we do have optimism about what will be seen in our emergency departments and in our hospitals in the coming days and weeks.
Let's go to KDVR Digital.
Hey, it's Alex Rose with Fox 31. Thanks again for hosting this press conference. I wanted to touch on the state's rollout of that KN95 and N95 mask program. It just seems like there was a lot of confusion in the general public. There are a lot of places that had to clarify, hey, we don't have masks. So I'm just wondering, what was the coordination like from a state level? Who's in charge of this program, and how well was that coordinated before it was rolled out and announced to the public? Thank you.
Thanks, Alex. This has been a partnership through the statewide unified command. And we are moving as rapidly as we can to always respond to the next set of needs in the pandemic. And so, we were moving quickly. We've communicated with our partners. For some locations, it was best to pivot to other locations. But really, we're just so excited that we have more than 200 sites now where these sites have signed up to be points of distribution for these masks. There are hundreds of thousands of them out in the field now, and we really just want to encourage Coloradans, go to the website first. The only sites that are listed on the website now are active and have the ability to give out the masks, and then go ahead and make sure you know what their operating hours, and we'll go from there.
All right, let's go to Rita.
Hi, good morning. Yes, would it be possible to get some sound bites in Spanish? I had the same question as the previous one, and something regarding what can we do for people that go to the sites, and if they will be running out during one day, can they go back tomorrow? There's other resources to see where they can go.
And Rita, I can follow up with you after this, because we do have a Spanish interpretation channel, and we can share that information with you to get you some sound bites for that, for questions that had been answered.
Okay, perfect. I'll go ahead and email you. Thank you.
Okay, thank you, Rita. Let's go to Kathy Walker at KOA.
Thank you. Thank you so much. I was just wondering about having someone verbally express where we're at in terms of testing positivity rates and available hospital beds. Just need that to translate better to radio. How are we doing?
Yes, I can certainly talk about the percent positivity, and then I don't know, Director Bookman, if you want to talk about the hospitalization data. So percent positivity, we are seeing improvements in our percent positivity values. They have come down. Our highest value that we saw was close to 30%. That value is now closer to 26%. But of course, those values are still really high and much higher than we've seen throughout the pandemic. So again, while we're starting to see improvements here, and we believe we've turned a corner on our Omicron surge, there continues to be high levels of transmission in our community.
All right, Johnny.
Brian, just real quick to follow up on the hospital capacity numbers as well. Over the Delta wave, as things were really, kind of reaching towards their peak, we would see somewhere around 75 ICU beds available across the state at any given moment. And today we see, consistently more than 100 ICU beds available at any given moment. So, again, while our hospitals are still seeing a high demand, we do see promising numbers in our ICU capacity.
All right, let's go to John Ingold.
Thanks, Brian. John Ingold from The Sun. I don't know if you saw in the chat, but Kathy Harshbarger posted that the trends that are being seen statewide in terms of case numbers are not necessarily being seen in all parts of the state. And so I'm wondering if you can elaborate on that. Are there areas of the state where cases are increasing, positivity continues to be high, hospitalizations are increasing, any sort of statewide variability on that?
Yes, thank you. That's a great question and a great point. Throughout the pandemic, we have seen quite a bit of variability from community to community. And we know that while overall state trends may show one particular picture, that doesn't mean this is necessarily the universal picture that's being seen in the state. So places in Colorado right now where we are continuing to see an increase, some of our larger communities that we would include the Pueblo area, El Paso County area, also Mesa County. We had seen the San Luis Valley still increasing, though they maybe are starting to see a little bit of leveling out at this point. So again, there are going to be some some variable trends across the state at this point. Honestly, the place where we saw those numbers level out first was some of our mountain resort communities, and then followed by the metro area. And that's really what's leading to the overall change in state trends.
Yeah, let's go to Rick Salinger. Go ahead, Rick.
Hi, this is Rick Salinger, reporter with CBS 4 in Denver. And that is very good news indeed that we are seeing a dropping off of the Omicron variant, as has been exhibited in other countries prior to us. There have been some experts in different countries suggesting that with the Omicron, as it dies out, this could be the end of the pandemic. Is that a possibility?
Yes, I mean, I wish my crystal ball was clearer here. I think, as we've said, I think 10 times or more now during this media availability, that we are feeling cautiously optimistic and do see positive trends in the data. We're working to try and understand what proportion of Colorado's population could potentially be immune at this point. But I also want to say that we've seen new challenges presented by this virus over and over again. We know that it's possible that Omicron is not the last variant we're going to see. And so I think we need to continue to be vigilant. I also, as I've mentioned, the case rates are still very high, higher than we've seen at any time during the pandemic. While they're coming down, they're still high. Hospitalization rates really are more in a plateau right now, so still very high. So I think we have a ways to go until we get to a place where we feel truly confident and comfortable with the level of transmission that's occurring. But until then, we're going to at least celebrate the fact that we've turned a corner and things are starting to look better.
All right, let's go to John Daly.
Hi, John Daly, Colorado Public Radio. Thanks for taking our questions. I wonder if you have any insights into folks who are out sick or have needed to be out due to catching the virus, either state healthcare workers or the state workforce, state government workforce, or beyond that in the private sector. We're hearing certainly anecdotally and around the country about a lot of people being sick with Omicron and not being able to work and being out. Teachers as well. Do you have any insights into any of that?
So, John, I don't think we have any specific metrics, numbers to give you right now. I think with Omicron, it just moves so quickly. But we have seen across the entire country and in every sector of the workforce that Omicron has moved through quickly. And we have seen, a lot of workforce issues associated with this. There are just so many Coloradans who are infected with this. It's impacting, so many different areas. And again, cautious optimism, the cases are beginning to come down, and that we will, begin to see the impact of this on the workforce begin to recede.
Let's go to Blair Miller.
Hey, it's Blair Miller from Denver 7. I was wondering, kind of last week we had a bunch of hospitals say that a bunch of their patients that were coming in for other things were then testing positive for COVID upon screening. And I was wondering if you guys had any insight on how that's affecting the hospital data, and basically if people are getting out faster because their COVID is less severe.
Sure, I can comment on that. So I shared some of that data last week. It is something that we are tracking in the state. So that difference between what proportion of the hospitalizations associated with COVID-19 are among individuals who are there for a primary diagnosis of COVID-19 versus those that are there with COVID-19. And so last week I reported that percentage of individuals that are hospitalized due to COVID-19 was about 65% of our hospitalizations. Our baseline throughout the pandemic has been about 80 to 90%. Monday's number and updating that data looks like it's a little bit below 64%. So drifting down a little bit, but not a dramatic change in the last week or so. I would say that, while we continue to see, a portion of these hospitalizations among people who are not necessarily in the hospital due to COVID-19, that those hospitalizations that are not due to COVID-19 still continue to put a significant strain on our healthcare system. Those hospitalizations may end up being longer than they may have been if an individual was not actively infected with COVID-19, it could extend their hospitalization. We also know that it's also more complex for healthcare providers to take care of patients when they're infected with COVID-19. There's PPE challenges getting in and out of patients' rooms, challenges in placing patients in long-term care facilities or other settings after the discharge from the hospital. So lots of complexities that go along with those individuals being hospitalized with COVID-19, even if they're not necessarily there due to COVID-19.
Great, let's go to Michael Rummel.
Hi, Michael Roma from KOA here. I'm just asking, because we've had people call in and ask us if there are going to be any more locations in El Paso County for the KN95 and surgical mask pickup, because we have only one location as listed right now, and the masks ran out rather quickly, and we were just wondering if there's any plans for expansion.
We are really excited that so many sites have started to opt in. We had more than 100 additional sites request to be participating in this program between yesterday evening and this morning. And so I don't have the specifics in front of me regarding El Paso County. We can follow up with you on that one, but we will continue to update our website so that everybody knows exactly what sites are active and continuing to enroll.
All right, let's go to Melanie.
Hi, yeah, Melanie Asmar with Chalkbeat. I'm wondering if you can talk a little bit about case rates among children and if what you're seeing in schools in terms of transmission. Thank you.
Yes, great question. So as we've seen with adults, we have seen a rapid rise in cases among children as well. We've also seen higher hospitalization rates among children for COVID-19 than we've seen at other times during the pandemic. So really, we're seeing those hospitalization trends follow those case trends. We know that transmission among kids can occur in multiple settings. We know that some of those transmission events occur in schools, others in extracurricular activities. Many others occur in household settings as well. So I think that there's certainly ongoing risk to our children, and really the best thing to do is for those kids that are vaccine eligible, so everyone 5 and up, is to get your kids vaccinated. And we also know that there's obviously booster doses available to our kids now as well. And so for kids that are booster eligible, getting those booster doses is really what's going to protect them most from infection, no matter what setting they're in, and then obviously from severe disease as well.
All right, looks like we have time for 1 or 2 more questions. Let's go back to Meg.
Hello, this is Meg from the Denver Post again. I just wanted to clarify about the hospitalization rates for people who are unvaccinated or vaccinated or boosted. So when you look just at the percentage of hospitalizations, it seems like there was a bit of a reduction in the advantage there for being vaccinated. But looking at what you showed us today, it still looks like a pretty massive gap there. Is that just a difference of looking at rates and age adjusting versus those raw numbers of the people who are hospitalized, or how should we understand?
Yeah, so a couple of things. So I did mention that the way that we are analyzing the data and the way that I showed it today and the way that it's posted on our website is to make sure our estimates are stable and reliable. We use a 4-week moving average. And so because of that, part of what we're measuring right now is still some hospitalizations that may have been due to Delta. So we can potentially expect those numbers to change slightly as we get further out and we're seeing exclusively Omicron differences. So you may recall that, I don't know if it was last week or 2 weeks ago, I presented more Omicron specific data that was more of a point estimate, not using that extended 4-week methodology. And so there were some differences in the numbers there. But again, overwhelmingly, we are seeing significant differences in risk of hospitalization for those that have received booster doses versus those that are unvaccinated.
All right, let's go back to Katie VR.
Alex Rose again with Fox 31. Scott touched on how Colorado has one of the higher vaccination rates in the country. Obviously, we've seen a record number of cases over the past month. I'm wondering what the latest modeling data tells us about herd immunity. It's a term I haven't really heard in a long time. Is it a term we should even be considering anymore, considering how unpredictable this virus has been with breakthrough infections? Thank you.
Yeah, great question. It's a question that I'm asking right now as well. A question that our modeling team is looking into is trying to understand what proportion of Colorado's population may have been infected during this Omicron wave, and then how that might translate to immunity in the short term and in the long term. I think there's lots of complexities in trying to estimate those values, but it's work that's ongoing, and we hope to have more to share soon.
Great. Thank you, everyone, for joining us this afternoon for our press conference. If you have any questions that we were not able to get to or that were not addressed on today's press conference, please email us at media_info@state.co.us, and we'll get back to you with some information as soon as possible. Thank you, Dr. Hurley and Director Bookman. And again, thank you all for joining. Have a good afternoon.